there's no question that in the healthcare industry and in healthcare business, regardless what field, what specific sector or subsector a person is in, the entire industry and major segments of it are moving under our feet from time to time, and sometimes with great upheaval and change. Some of that brought on by medical progress, some of it by doing things differently, reorganizations, mergers, and all kinds of things. So somebody in my position who's been in the business a long time, I can't count on my past knowledge. Yes, it helps me analytically, but I need to keep up with what's going on. And so what I did for you is in the last few days, I just went to a couple of gateway websites that I happen to know. One is Healthcare Finance News. And I just picked out some articles. I'm just going to show you a few things that are going on. It just came out on September 9th that hospital medians show positive net revenues for the first time in 3 years. These are very, very thin margin businesses. And the investment banking community and investors need to be aware of that. And most of them are aware of it, especially the ones that are active in the business. It's a very, very tough business. Here's an article. Smaller nonprofit hospitals actually led a turnaround in margins, according to Fitch Investor Services. Maybe that's because they don't spend so much time merging and aggregating critical mass. There's a debate whether mergers really lead to greater value. But the point is, smaller nonprofit hospitals had some positive results. That said, there are a number of critical access hospitals around the United States, and people, including myself, are concerned about them longer term. And we've had situations where some critical access hospitals have closed. Mergers, there's been really a craze for mergers in the last 15, 20 years, but especially in the last 10 years since Obama came into office. And there is a widely held belief that more aggregated critical mass and market share is better. I think that is true to a certain extent, but is there more value? Is there greater efficiency? That is a question. And here, Tufts and Harvard Pilgrim merging their healthcare organizations. The Mayo Clinic, we have nationally known, renowned organizations like the Mayo Clinic, the Cleveland Clinic. Some of them have gone overseas now. The Mayo Clinic also has other locations in the United States. How is that going? Are they preserving and enhancing quality? How far and how much can you go without compromising quality? How many top physicians in various disciplines are there really? Those are just questions. I don't have the answers. But here they're now going to open and joint venture in London, England. I'm telling you, these are just from the last few days. I went to the Cleveland Clinic's website, and of course they have Ohio hospitals, but they have an organization in Abu Dhabi, and they have a Cleveland Clinic in Florida, outside of Miami, on the west side of Miami, and it's highly thought of. Then they have a Cleveland Clinic in London. Same principle, same questions. Why are they doing this? Well, they're probably doing it. These organizations are doing it to enhance their reputations, but most important, from a business standpoint, to get their arms around greater market share. Greater market share. Here is a report by Kaufman Hall. Kaufman Hall is a highly regarded firm on hospital merger and hospital M&A activity. And you can see here the last few years, the number of mergers. And most of these are very large mergers. And so they, again, the hospital sector keeps merging and aggregating more mass. Are they aggregating and accomplishing greater efficiencies, greater profitability, more efficient patient care, better patient care? Are they modernizing and getting more into the outpatient sector? I don't know the answer to all those questions, but those are questions that should be asked. But there is no question that there's a tremendous amount of merger and acquisition activity in healthcare, especially the hospital sectors. I mentioned rural hospital closings. This is a serious problem longer term, and a number of hospitals have closed. A number of hospitals still exist, but have closed their emergency departments and other outpatient centers. There's a question. A lot of physicians have merged with hospitals, including some medical groups. And as you can see here, this again is still from Health Finance News. This article is September 6th. I obtained all this information about the last week or so. But the point is, when physicians integrate hospitals, costs go up, according to a new study. In 2003, about 29% of hospitals employed physicians in the US, and now 42% did by 2012, and that's even higher now. I don't know why that's all the data they have is through 2012. That's a long time ago by our standards. But the point is, do acquisitions of medical practices increase efficiency, patient care, quality, etc.? These are questions. I don't necessarily have the answers. A lot of what an analyst does is look for areas to look into further, frankly. Here's a trend. Virtual care services. Some are now being reimbursed. Virtual care services also go into the specialty area. Here's a kidney care center with home dialysis and what they call tele-enabled care. And that says a lot about both the use of what's called telemedicine, but also medical progress. Medical progress has now created a situation where large-scale home dialysis is technologically possible. And again, that changes other industries. Every time somebody gains market share, someone else can lose market share, and therefore the revenues accompanying that. We need to keep that in mind. The CMS star ratings, there are ratings of all kinds of hospitals and medical centers, health systems. There are ratings for doctors and every other kind of provider. Here they just released some ratings for the first time of home health agencies, and it says here very few earned high ratings. So we have to see what's going on here. I haven't looked into this. This just came out the other day. 769 hospitals, this was a January report, 769 hospitals were fined for medical errors according to CMS. And that will be updated later this year. And there are other websites that track things like infections. It's thought that a lot of hospitals are lax in reporting infections and reporting causes of death by infection. The opioid crisis. Here's an article where Cuomo, the governor of New York, launched a $2 billion legal action. And that article just came out on September 10th. Here's something from September 5th. The Kentucky hospitals sued drug makers. You've seen a lot of publicity about opioids. I don't need to go over this. The Medical Group Management Association, this is an article that I published in the Journal of Healthcare Finance. I'm the publisher and editor and have been the editor since 1994. But the point is, this article came out last spring, in the spring of 2018, and was a report from the MGMA saying there's expected to be a shortage of primary care physicians. But in addition to that, the compensation of non-physician health professionals, nurse practitioners, physician assistants, and so on, had been increasing markedly. This is a sign of the times, the advent of non-physician caregivers in major roles. And if you go to an urgent care center in a lot of parts of the country, you're seeing a non-physician caregiver, at least as on the first encounter. This is part of a survey that was done of doctors, and it's interesting that they say the largest barrier to good health care is higher deductibles and patient cost sharing. I'm sure you all have read about this. This was part of a survey. And here's an article that came out a couple of weeks ago. The next frontier in reducing cost of care, patient affordability. And the question is, one of the doctors they surveyed said, we are going to have to do basically like GMAC. We're going to have to start financing our own receivables from patients. And some people are doing that. There are also companies that do that. Let me see here. Some health systems are still suing lots of patients. This is an article from just a few days ago, September 9th, and this has gotten a lot of publicity. It calls into question if it's a not-for-profit, it calls into question their charitable purpose, according to some people. These controversies ebb and flow. The controversies over not-for-profit hospitals ebb and flow and have done so for decades. In the LA Times on September 7th, the hospital giant Sutter Health, which I think is headquartered in Northern California, is also under investigation for not behaving as people think they should in terms of their tax-exempt status. UPMC, the University of Pittsburgh Medical Center, same thing, involved in a controversy in Pennsylvania about their charity care, their mission, why are they tax-exempt, and so on. Now, hospital pricing. Congress is coming back to work, and there are two issues related to pricing, at least. One is the so-called surprise billing, and the other is price disclosure of true price. And the Trump administration has ordered transparency in this area. And here's an article about that. By the way, one of the other publications I look at is called Fierce Healthcare. There are probably 5 or 6 websites that have current news, industry news, oriented toward the healthcare industry and healthcare finance and so on, that I check. And this is one of them. This article is about the critique of quality. How good are the quality comparison sites and quality rankings? I'd like to switch gears for a minute to talk about something that came out in the spring. A big challenge now is that a lot of the top drug companies have either abandoned or cut way back on their Alzheimer's research. And this is considered a problem. And here is the Dr. Scott Turner, the head of the memory disorders program at Georgetown University, basically saying that the best thing in staving off Alzheimer's is a good diet and regular exercise. And he spoke to the National Press Foundation in May. That took a lot of people aback, frankly, and we have to look into that more. But if one of the top doctors is basically admitting that real progress in research on Alzheimer's has lagged behind and in some cases failed, that's a big problem, because we have a tremendous challenge ahead if millions of people need caregivers in the future. Investors are investing in, independent investors are investing in certain kinds of medical campuses. Here they invested in a surgery center. This is from one of the other sources that I check, Becker's Reviews. He has reviews about hospital care, ambulatory surgery centers, and all kinds of other things, infection control. And he and his staff do a pretty good job keeping up with healthcare industry news items. It's a quick way to check to see what's going on, checking some of these basically free gateway websites. Nurses on strike, and nurses concerned about quality of care, and some of them tie labor actions to what they consider to be inadequate staffing. Here's a situation in Florida where a nurse claims to have been fired for being concerned about unsafe staffing in their emergency department. And here's another, I think this is from California. Nurse to patient staffing ratios have been dealt with and raised by the nursing profession for decades. And so this is just one more thing. Well, I wanted to show you some of these types of news stories, and I just went through a bunch of these and picked out several that were written about in the last week or two. I'm sure you and your fields could do the same thing. The point I'm trying to make is that it's crucial as we go forward to remain open-minded, number one. Number two, to realize that technological progress often drives business. And number three, to keep in mind that the shifting of progress, controversies, and various other things can affect things like market share and financial viability. And that there really is, I don't think during our lifetimes, there will be a homeostasis or total reckoning and calming of the waters. Part of the upheaval is driven by technological progress, which will continue, and part of the upheaval is driven by politics and things also within the industry, such as power struggles and so on. But I don't think we're ever going to get to the point where we can lie back and say, okay, everything's going to be fine from here on out, it's going to be stable. I think there's going to be a certain amount of instability. The trick is, in this course and in your lives, to be open-minded to being receptive to learning about what's going on and what are the possible impacts of what's going on.